Good afternoon, everyone. This is Dr. Famuyiwa, your host of Fertile Talks. So today we're going to do something different. We're going to be talking about how your thyroid may have an impact on your ability to conceive. So, just a little quick fact, your thyroid gland is shaped almost like a butterfly shape sitting at the base of your throat, at the base of your neck, if you want to look for it. And it's much overlooked gland, if you will, because the gland secretes hormone until it causes us trouble. Now, one of the ways that it could cause trouble is it could be impacting whether or not you are getting pregnant. So, when the thyroid does not produce enough of the hormones that it's responsible for, that's called hypothyroidism, that can slow down your entire body. And one of the things it slows down is also your reproductive system. So symptoms usually develop very gradually, and most patients that have this problem don't realize that their thyroid is underactive until they start to have problems getting pregnant. So, how can the thyroid gland or lack of the function of the gland affect fertility? One of the ways it does this is to disrupt ovulation, and that can lead to prolonged, heavy, or irregular cycles. It could also cause low progesterone levels, right, which is essential for proper implantation of the embryo in the uterus and also proper maintenance of the pregnancy. It can also increase the risk of a miscarriage. The common symptoms you have if your thyroid is not working well will be feelings of fatigue, sluggishness, some weight gain, even from a normal diet, dry and skin with brittle hair, sometimes feeling cold all the time. So if you ever ask yourself if everybody is boiling hot in a room and you're the only one shivering and freezing, maybe you need to have your thyroid checked. And it can sometimes cause depression or a brain fog. So women who are have symptoms of hypothyroidism are 3 times more likely to experience infertility than those with a normal function, thyroid function. So you really want to have your thyroid checked. The other extreme of this is when it's overproducing. It's really crazy, but the opposite of that can be problems, lead to problems too. So when the thyroid produces too much hormones, it speeds up the body's processes, opposite of slowing it down. Well, this can also include speeding up your metabolism and your reproductive function. And that may sound like a good thing, but it actually shortens the menstrual cycles and it makes it harder for an embryo to implant properly. So, how can hyperthyroidism impact your fertility? Can cause short, light, or absent periods. It can increase the risk of miscarriage or increase risk of a early delivery, like a preterm birth, and also lead to difficulty gaining weight, which may affect hormone production. So, common symptoms with hyperthyroidism would be unexplained weight loss, anxiety, nervousness, restlessness, a rapid heartbeat, palpitations, and also when everybody is sort of cold, you may be feeling hot. Now, that may sound like a hot flash, maybe similar, but if you're not menopausal and you're getting all these flashes, maybe it's your thyroid. Maybe you need to check it out. And if your thyroids are over functioning, you may also have problems sleeping, and you may also have mood swings, right? So women who have undertreated or untreated hyperthyroidism during pregnancy are at higher risk for preeclampsia, for heart failure, and also for low birth weight babies. So I encourage you that one of the things that you need to have checked when you're trying to get pregnant, especially if you're having all the symptoms that I've just mentioned, is actually your thyroid um, function test. So again, this is Dr. Famuyiwa, your host for Fertile Talks. Until the next time, Thank you very much for your attention. And if you find my information helpful, please put a comment and rate us. It really helps us with the algorithm so that we can share more of our message with everybody else who's struggling with trying to get pregnant.